Hello everyone and welcome to this RCSLT webinar entitled Easy EBP Resources to Support You. My name is Amit Kulkarni and I am a paediatric speech and language therapist and the research manager here at the RCSLT. I am very happy to be delivering this webinar today along with my fantastic co-presenters. So we have Dr. Hazel Roddam, who is a reader in allied health practice at the University of Central Lancashire. We have Katie Chand, who's our research support officer here at the RCSLT. And we have Anna Sowerbutts, an SLT at Children's Integrated Service for Hackney in the City. Our webinar today is 45 minutes long and we'll have some time for questions at the end. There are ways to interact. At the moment, you'll only see your name and the names of the panelists in the list of the participants. But there'll be lots of other people online. I think we have about 192 people registered. You can use the Q&A button on the webinar software to submit a question anytime for the panel. And we will answer as many questions as we have time for. But we've already received quite a few prior to the event. So we may take these in themes at this stage and then think about answering specific questions in some follow-up materials that we'll put together after the webinar. The webinar is being recorded and will be up on the RCSLT website within about 2 weeks after the event. And you can use the chat button on the webinar software to send an instant message to the host. You can do that anytime during the event. And Kaylee Mayetta is on hand here to help answer any technical questions you may have. Now, if you use Twitter, please do join in the conversation using the hashtag RCSLTwebinar. Also, we'd be very grateful if you'd fill in the evaluation form. They'll be emailed to you out post-webinar. That's the end of the main housekeeping points. So I'm going to move on to the aims and objectives of the webinar today. To summarize these aims and objectives here, firstly, the one aim for the webinar is to learn about the evidence-based practice model. Why is it important to you as an SLT? And think about some current controversies and questions around the model. We'll also think about existing RCSLT resources that can support you to take an evidence-based approach to practice. We'll hear practical tips from Anna, a member who has used some of these resources and other resources in order to take an evidence-based approach. And there'll be an opportunity for you to suggest further resources that the RCSLT could develop to support with your evidence-based approach. So, with no further ado, I will hand over to my colleague Hazel, who will begin.
Okay, hello everyone. I'm Hazel. I'm a speech and language therapist and I'm a researcher in allied health practice. And I wanted to start today by just clarifying the focus today. It's about using research findings in our routine practice, not about producing research or being research active. We're all accountable for our own clinical practice to demonstrate that we are aware of the latest current research in our own field. And so I've put this quotation here because this might be useful to you to be able to help you secure any appropriate support that you need to help you to do this. And of course, this is a universal challenge. It's being discussed by our professional colleagues worldwide. And in recent years, I've worked with a high number of other SLT associations, especially across mainland Europe, to help them develop their policies and professional guidance about evidence-based practice. But before we go any further, we need to be really confident that if we're going to use a lot of energy to promote evidence-based practice, that it's going to make a difference, it will make an impact beyond mere theoretical discussion and academic learning. So this paper is a seminal review paper that's looked at this key question across healthcare professionals. The paper is open access and the lead author, Annette Boas, is one of the invited keynote speakers at the Royal College of Speech and Language Therapy conference later this year. And here for you are the main headline findings from this paper. As you might expect, there are many influences on clinical outcomes of care, but there is some limited positive evidence that where staff are evidence-based, it can improve clinical outcomes. And there is much stronger positive evidence that where staff are aware of research evidence, it does improve evidence-based processes of care. And also, very importantly, it improves patient-reported experience of care. But we've got to acknowledge there are very many challenges in evidence-based practice. We've got over 20 years of barriers research across nursing and mixed groups of allied health professionals with very high agreement on what those challenges are. So one key challenge is this iceberg principle. We need to all be more self-reflective and more transparent about how we weigh up the balance in our own judgment between published research evidence and our own clinical expertise, and discussing that with the patients. And of course, the other challenges that are inescapable are our time pressures and the sheer volume of research. So we all need to be much more strategic about how we are going to make ourselves have an effective reading routine that will help us keep up to date. And no matter how confident we are that we are up to date in our own area of practice, there will always be these two drivers that mean that we do need to have skills and resources for helping us to look for new research evidence. So when we start to think about what is evidence-based practice, this is the most familiar model that we think about, David Sackett's 3 domains and his 5 steps to be able to achieve evidence-based practice. But over time, it has been proved that this is really rather overly simplistic in terms of a fit with our real-world context for practice. And in particular, this model did lead to a rather disproportionate focus on published scientific research, and in particular, the emphasis on the experimental quantitative research paradigm. And that would never be sufficient to generate the awareness and insights that we need to reflect when we're working with complex cases and highly heterogeneous populations. So this is the direction of shift of perception of evidence-based practice. Tricia Greenhalgh has been one of the pioneers of evidence-based practice, but is now concerned that we need to recognise that simply talking about EBP, the rhetoric, will not really make any meaningful impact. We need a commitment to an ethos which demonstrates what it really means. So I'm just going to very quickly take you through the 6 points that Tricia Greenhalgh highlights. And firstly, ethical care. This means that our practice must be values-based. We must focus on the patient perspective, their priorities, their preferences. And we've got to present the research evidence to the patients that's meaningful and relevant to them, not statistics from large population studies, for example. We do need our expert experience, clinical judgment. Evidence-based practice is not like a cake recipe where you do the same process every time. And shared decision-making is key. It's our responsibility to present the evidence to the patients and their families so that they can make informed choices. And please do watch in the coming months for the Royal College, who are going to be presenting their involvement in the Informed Health Choices project in collaboration with University of Oxford and Oslo. We have unique advanced communication skills that allow us to be able to make strong relationships to get the trust of the patients and families that we work with. And when we do that, we can then discuss their treatment options. And we must remember that evidence-based practice was always intended to be relevant to all levels of our service delivery, not only with individual patients. All our services must be evidence-based. But apart from those differences in perceptions and definitions of evidence-based practice, we're also recently seeing a change in terminology. So this analogy of a pipeline between research and practice is actually very helpful. This is more prevalent, and you will hear this terminology more in the coming years. You'll also hear this terminology about implementation science. So over the past few months, the Research and Development Forum in Bulletin has been featuring explanations and information about quality improvement, including implementation science. There are many terms which are not interchangeable. They all have distinctive definitions and meanings. However, overall, implementation science gives us a more sophisticated and highly structured framework for supporting getting research into practice and in evaluating and measuring how successful that has been. So there's a link here for this toolkit, and I also recommend this paper, which is a very helpful introduction to show how in our area of work we can use implementation science as a support to help us assure more clinical excellence for the patients and their families with whom we work. So I'm going to pass on now and introduce my colleague Katie, who is going to talk about the RCSLT resources.
Thank you, Hazel. Hi, I'm Katie. I'm a speech and language therapist. I'm also the research support officer here at RCSLT. And I'm going to talk about a few of the key resources that we have which are aimed at supporting therapists to take an evidence-based approach to practice. So many of the things that I'll talk about can be attributed to an individual aspect of the model that Hazel's been talking about. And I'll use this model to talk through each resource, but in reality, each resource will likely facilitate more than one of the components of EBP. And we'll need to bear in mind that EBP is an integration of all these different types of evidence. The central place for information about EBP in general is the research area on the RCSLT website. You can find an overview of EBP and a multitude of links to other helpful resources, both from the RCSLT and other external organisations. One of the things you can find here is our e-learning module called An Introduction to EBP for Busy Clinicians. This is where you can revise the underpinnings of the EBP model, much like we've heard about from Hazel already, but also get practical ideas and tips on how to bring EBP into your clinical practice. For example, tips on setting up a journal club. Now I'll go through some resources that will particularly help with the research section of the EBP model. The main resource that the RCSLT provide to facilitate this is our journals library. So included in your RCSLT membership is a subscription to thousands of journals where you can read and download full text articles for free. To be able to do this, you have to be logged into the RCSLT website, and then you access the journals through our library. Here there are also guides and top tips on, for example, signing up to content alerts, where to find open access titles and other options for getting access to journal articles. We know getting hold of research articles is one thing, but getting a hold of what they are actually saying can be another challenge entirely. So to help with this, we have another e-learning module which is specifically aimed at developing your skills in reading research papers, judging their quality, and identifying and understanding the most relevant information for your clinical practice. Further to this, each of the clinical guidance pages on the website includes a dedicated evidence area. So this highlights important research for each clinical topic, including relevant systematic reviews. This is a really easy way to find key articles relevant to your practice. Another easy way to stay on top of the latest research is by reading Bulletin. So each issue features the In the Journal section, and this has short summaries of important clinically relevant research articles, and also the R&D forum, which includes helpful articles relating to the application of evidence to practice and other similar EBP topics. Finally, the RCSLT research team have a number of communication channels, such as social media and also a research newsletter, and we use these to highlight the latest news, research publications, as well as research opportunities and other resources. The RCSLT supports a number of initiatives that are created to help with EBP. One of these is SpeechBite. SpeechBite is a database of research articles. You can search for the latest articles relevant to your clinical area, many of which are rated in terms of the quality of the study and its methods. It also sends out a helpful monthly newsletter where it lists all the research published in the last month in each clinical area. What Works is also supported by RCSLT. The What Works database contains a range of interventions for children's speech and language, and again also provides ratings for how strong the evidence to support that intervention is. The RCSLT is also linked to a number of other initiatives, and we would actively encourage members to check out some of these resources developed by other organisations. In terms of clinical expertise, there are a wealth of resources from RCSLT to help members to share their experience and their expertise. On the website, as already mentioned, you'll find the clinical guidance for most of the areas that you're working in. These have been developed by RCSLT members who are the experts in each field and draw both on the research evidence and their clinical knowledge. Similarly, the events hosted by RCSLT are a great opportunity to hear from colleagues and experts. A key event, as we've already mentioned, being the RCSLT conference later this year. Another crucial part of supporting you to share clinical expertise is the different kinds of groups and networks that the RCSLT facilitates. So this includes SENDs and hubs, which you're probably familiar with. But also there are specialist groups such as the Research Champions, which we'll hear a little more on later from Anna, but also mentors and access to clinical advisors via the RCSLT. The Route is an important tool that you can use to capture the impact of your clinical work and also compare your outcomes with others across the UK. It can help you to use your clinical data to inform your own decision-making and evidence-based practice through a number of ways. If you're interested in finding out more about Route, you can check out one of our previous webinars called Are You Route Ready? As speech and language therapists, we place pride on the fact that we know you are well placed to be communicating effectively with clients and service users about their preferences in their care. The client perspective is therefore integral to all of our guidance, but we do have a series of professional guidance which speaks more specifically to eliciting and incorporating patient and family views on speech and language therapy. This includes recommendations on things such as shared decision-making, collaborative working, goal setting, and enabling service users, families and carers. The RCSLT are also running a research priority setting project, which is a collaborative and multi-stakeholder piece of work where patient and public preferences are central to the development of research ideas which are to be prioritised by funding bodies. But the outputs of the work highlight key areas of concern and uncertainty raised by patient groups, and so could be used as prompts for your reflection about your service users. Our campaigning initiative, Giving Voice, also focuses hugely on getting the voice of the patient out into the world, and there are many ways you or your service users could get involved in the future. You can listen to other client perspectives, for example, through the My Journey, My Voice videos. So we've now seen that there are a range of different resources and initiatives from the RCSLT to facilitate your thinking around each part of the EBP model. So if you are looking to develop your skills, understanding and application of EBP, these RCSLT resources are probably a good starting point. Ultimately, equipping yourselves as therapists to understand the full range of the evidence base behind your practice and incorporating each of these into your clinical decision-making will help your service users obtain the best outcomes in aspects that are most meaningful to them. And I'm now going to hand over to Anna to hear about her experiences as a clinician.
Thanks, Katie. So I'm Anna. I'm a speech and language therapist working in Hackney, and I'm going to talk a little bit about my experience of EBP. So one of the biggest challenges to upholding an EBP approach when working clinically is time. With the pressures of caseloads, it can often feel like a huge ask to find time to squeeze in yet another demand. But there are lots of ways to make EBP a more integrated part of your work rather than an add-on. So I'm going to share some tips based on my experience for how individual therapists and teams can incorporate EBP in a time-efficient and relatively pain-free way. So as an individual therapist, it can feel daunting to try and keep up to date with what research is being published. But there are lots of ways to keep your finger on the pulse without having to trawl through journals. Some organisations have newsletters you can sign up to, and Katie's already mentioned both of these. I've particularly found Speech Bites useful for finding out about papers that are relevant to you. So each month's newsletter contains a selection of recently published papers, and these are all organised under clinical disorder headings. So you can skip the ones that aren't relevant and go straight to the ones that you would use in your work. It's also really useful because it highlights which of these papers are open access. I'd also recommend signing up for email alerts from journals that you're interested in. So you can be notified when a new issue is released and see which articles are published in it, or you can set up an alert for articles featuring keywords. So for example, you could set it up so that you receive a notification whenever an article related to DLD and vocabulary is published. If you work for the NHS, you might also be able to sign up to Knowledge Share. So this is where you tell your library what you're interested in and get notifications when things are published. I also just want to highlight this journal, Evidence-Based Communication Assessment and Intervention. So this journal actually appraises studies and reviews and provides expert commentary on the quality and the practical implications of the research. So it's a really useful one for clinicians who want a very practical take on research. Twitter is also a good resource for getting a taste of what research is going on. I'd recommend finding out what the hashtags are for the things that you're interested in, and so that you can quickly scroll through any new developments. You can also contact researchers directly to ask them about their research and often request a copy of the paper. Twitter chats are another way of finding out about research and discussing it with others. And RCSLT is a research support network led by Hazel, which holds monthly journal clubs via Twitter and has a website. And anyone can join in these tweet chats. So that's for keeping informed generally. But what about when you want to find evidence for a particular intervention or clinical condition? So this particularly can feel a bit daunting, and if, like me, you've ever hopefully typed in intervention plus the name of a condition into Google, you'll know that this approach doesn't often get you very far. So a far better method is to access pre-digested evidence summaries. Lots of databases have very helpfully collated the evidence, often summarising across several studies. So links to these are all available on the RCSLT website. You may already be familiar with what works, but there are lots of other ones out there. I'm going to particularly recommend SpeechBite again, as it covers a range of client groups. So as well as producing the newsletter, SpeechBite is great for searching for evidence for interventions. So for example, if you want to know what research is out there for group language therapy for teenagers with DLD, you put in those terms into the criteria boxes, and a selection of articles is provided. And it's normally quite a manageable number, so you don't have to look at too many. So that was for sort of individual therapists. Now thinking about, as a team, how can we create a culture of celebrating and prioritising EBP? I think this is a really important thing, and it's something that research champions can help with. So if you don't have one in your team, I recommend becoming one or pestering somebody else to. And if you are one or planning on becoming one, I'd suggest arguing for dedicated time from your manager to do this. It doesn't have to be a lot, but half a day every now and then can be really useful. The RCSLT has suggested activities for research champions to do, but you can also come up with your own initiatives. So something I set up in my team was a monthly newsletter, Evidence-Based Practice in Hackney. We have a very large team working across a range of clinical areas, so the newsletter had to be engaging, of broad interest, and also accessible enough for therapists to be able to read in their CPD time. So the result is a one-page, light-hearted newsletter which has small chunks of information. Each issue includes links to and summaries of 1 or 2 journal articles, any team EBP news that's going on, like SENS people have been to, or any research projects people are doing, and then summaries for what's the evidence for different types of interventions, and then a brief guide to an EBP resource or a book of interest that might be out there. So these are sent by email once a month, and in the body of the email I list what's in the newsletter so that people can see if it's relevant to them. I'm lucky in that because I work in schools, I can do a lot of the prep for these in the school holidays and get ahead of things. So things like what's the evidence for summaries are often written ahead of time. But you can also ask other therapists and even therapy students to contribute. Writing a short evidence summary for an intervention is a really good CPD activity, and also something that's quite manageable, isn't going to take up too much time for therapists. And so far the feedback on these newsletters has been positive, and therapists find it's a good way of quickly keeping up with the evidence. So I'd also advocate for making EBP whole team sessions a regular thing. I've found it best to make these very practical so that everyone goes away having experienced finding the answers to a clinical question or having signed up to a new database. So this is an example of an activity I did at a whole team session, a bingo, where they had to use different resources to find the answers to different questions. So journal clubs. If these are done without a clear purpose, journal clubs can feel a bit pointless. Everybody reads the paper in a rush 10 minutes before, then we all try to critique the number of participants because we think that's what we should be doing. A far more useful method is to start with a real clinical question that somebody has. Then as a group, you find a relevant paper using the methods we've already covered. Then all agree to read it before the next meeting. Then at the next journal club, you discuss it together and agree if and how you're going to put the findings into practice. If you don't have a journal club in your team, you could start one, or you could join the Twitter ones and find colleagues that way. So hopefully you've picked up some tips to make EBP a bit less daunting, and I'm going to hand you back to Amit.
Thank you so much to all of you there for those that fantastic overview of the model, of the resources that exist, and also of some practical examples of how to take that evidence-based approach. We've got some time now to respond to some of the questions that we've had. We've had quite a few, so what I'm going to do is maybe not focus on the specific clinical details in some of the questions, but try to extrapolate some of the key themes and then put those to the panel. So one of our first questions was this: how can we apply EBP in broader SLT work? It can be hard to find the evidence base for working in different settings. Hazel, I wonder if we could come to you first for a response on that one.
Yes, I think this is a really useful question because predominantly our research evidence base in speech and language therapy and across other allied health disciplines is quite traditional. It focuses on direct therapy interventions. And so there's a high priority need for us to develop a stronger evidence base for the effectiveness of our different service delivery models, whether we're working in indirect roles or in new areas of emerging practice. So yes, there's an evidence gap, and there are many methodological challenges to being able to answer that gap with research designs. Traditional research designs are very specific, and when you're trying to measure complex outcomes in the context of service delivery, where the setting is often changing very rapidly, it can be more appropriate and more relevant to look at service evaluation designs over traditional research designs, and in particular looking at the implementation science frameworks and the tools that we highlighted earlier at the beginning of this webinar. So in that way, we're able to think about generating robust, systematic evidence, which gives us a more realistic time frame to be able to answer some of those questions about effectiveness of working in different ways.
Fantastic, thank you. I don't know if others have anything to add on that question. I'd just like to add myself that I think taking that kind of practice-based approach to evidence is a fantastic way to approach such a situation. And Hazel, it was wonderful to hear about some of the different methodologies that can be used to approach that. I'm going to move us on now to our second question, which again I'll come to you for, Hazel. What way can we suggest to support and develop less experienced colleagues' use of the evidence presenting from our direct interactions with patients, integrating more formal evidence into this from the literature, audit, etc.?
Okay, yes, this is another good question, because we all need to have the confidence that we're making the right judgments and decisions about our case management. I mentioned this earlier as well in the webinar presentation, that it can be very important to be very reflective about our own clinical reasoning and to be much more explicitly aware of what are all the other sources of evidence that we're taking together. So we recommend that it works really well in team meetings, as Anna was describing, to focus on either a specific aspect of the local service delivery or on a case presentation, so that within quite a systematic template you can present what's the clinical presentation, what's the clinical challenge for this patient, what's the research evidence which could be relevant, and what are other evidence sources about policy and good practice guidance from the Professional Association, for example. And another ingredient not to overlook is what's the intervention history. So especially when we're working with people and families who've had long-term conditions and a lot of prior experience of therapy, we need to understand what their experience has been, what worked and what didn't work, and maybe understand why. So this type of total evidence appreciation works well if you've got a framework. So having a systematic framework to be able to work through and to share those cases with each other within team settings. I've got a paper which is currently under review and hopefully will be published soon, where we present such a framework that we hope will be helpful for people to weigh up all these different sources of evidence, the patient evidence, the published scientific evidence, and professional sources.
Fantastic. Thank you, Hazel. And I'd just like to reiterate that that focus on genuine reflection, I think, is really key for helping all of us, including less experienced colleagues, to really start considering the nature of their interventions and ensuring that they're as service user focused and as effective as possible. I'm going to come on to another question now. So we've had a question which runs as follows. I want to find out about how to access evidence that's available on the RCSLT website easily and quickly. Please could you give me any information about this? So Katie, I'll hand over to you.
So I'm hoping, part of this webinar might have answered some of these questions. But I think probably the best place to start if you're looking for evidence on particular clinical topics is these clinical guidance pages, which are on the main sort of section of the website. And once you've navigated there, you'll see that there is a whole evidence section, and that's quite clearly presented, divided up into systematic reviews and other journal articles. But also, to find, to sort of browse the evidence more widely, the journals A to Z library is probably a really good place to start, and the journals library can be found in the research section of the website. Also just thinking about some of these other things that we've mentioned, sort of these pre-digested summaries. So in the journals from the bulletin, and I think Anna's referred to a couple of different clinically focused things on her slides as well. But I think they're the sort of key places on the website, but it's certainly not limited to those ones. And we would encourage you to kind of be looking at some of these other resources as well, because they can be really helpful to presenting those summaries, I think.
Fantastic, thank you. And just to add to that one, I mean, what we try to do is ensure that the information that we present runs across different mediums, because we know that people like to access information in different ways. So as Katie detailed in the slides, as well as all the RCSLT resources we have on the website and links to other resources, We also have information, for example, about clinical advisors that you can speak to or SENDs that you can attend, where again you can really discuss not only the EBP model but also the latest evidence and reflect upon that in your area. I'm going to come on to another question now. So this one is more about sort of CPD and recording. So it goes as follows. Do people record evidence-based practice or trialing and piloting of approaches as part of CPD for their diaries? Oh, sorry, and I will come to Anna for that one, please.
So definitely, I think that's a really good idea to use a CPD diary or a log as a way of capturing the evidence-based practice that you're doing. If you're a newly qualified therapist, it's also really useful when you come to bringing together the evidence for your competencies after you've been practicing for a year. And I think as well, for anybody though, if you're recording it and actively reflecting on the evidence-based practice that you're doing, you're more likely to implement it and to feel confident using it. And if you're writing it down in some form, reflecting on it, it also makes it far more easy to share with others in your team, which I think is a really valuable thing to be doing. But particularly people that work with a very diverse caseload, it's very difficult to pursue the evidence for each different clinical disorder. But if we work sort of with our colleagues that may have other specialist interests and write up our evidence-based practice, we can share it with other people. It's also really good to record the EBP that you do in your diary or your log so that you can demonstrate the value of what you're doing to your managers. And then particularly when it comes to asking to go to SENDs or training events, you can show the work that you've been doing prior to that and why it's really useful. And that can also inform your appraisal, and it's a really good log to have to show that you are doing EBP.
Fantastic, thank you, Anna. I mean, I think I'd like to also add that it's still the EBP model, whilst it, as Hazel has discussed, has had some accusations thrown at it, particularly in the sort of previous guises. But as the model's been updated and with Trish Greenhalgh and others sort of taking forward of the model, it now remains as the internationally accepted model of healthcare provision, and hence, in a way, it's our duty, if we're going to provide the best service for our service users, to ensure that we are practicing in line with that model. As everyone has highlighted today, we know there are some areas of that can be difficult, but hopefully the resources that we've discussed can really help you with that, as well as taking that reflective approach and ensuring that all of your interventions are truly guided by your service users and their preferences. I'm coming on to quite a brief question now, which I'm going to direct towards Katie. Essentially, the question is around, how do I decide which outcomes to measure?
Thanks, Amit. Well, I mean, that's a pretty broad question for us to try and tackle in this very brief Q&A, but I suppose just as a starting point is to think about that using the model that we've been discussing today. So we know that essentially what outcomes you want to measure need to reflect the client's goals for their intervention, and it should certainly speak to what they want and sort of what success would look like for them. I think that's an important part of selecting an outcome measure. But obviously, as we've heard today, there are other aspects to this. So looking at the research and the sort of, sometimes it's important to look at the psychometric properties of different kinds of outcome tools or assessment options. And there's also been some work done by the RCSLT on the outcomes programme, which is looking at a range of different outcome tools exactly for this reason. So, for example, the use of TOMS can be applied to lots of different clinical areas, so that might be something to look at. But also thinking about some of these other experts that we can speak to, so the clinical advisors that you can contact through college are probably very well placed to make recommendations, specific outcome measures in certain clinical areas. And again, it's coming back to thinking about all these things together and integrating all the different opinions and bits of evidence to kind of choose the best outcome measure for you locally and also for your patient or your service user.
Thank you so much. And just to add one bit to that, I know we're talking about taking an evidence-based approach to practice now, so I hope I don't confuse people with this kind of veering into research. But just to say, if you are considering as part of your evidence-based approach to practice, you've started to collect data and you've identified a promising new approach, you may want to develop that into a practice-based research project. And then, as well as the clinical academic mentors who can help more from that clinical point of view, as well as the clinical advisors that are more focused on the clinical point of view, we have our clinical academic mentors who can help with starting to think about designing research, quality improvement, and even service evaluation and audit projects. So please do utilize them as a resource as well. That ties us in fact, to a question that we've had, which is focused on how to become a research champion. So Katie, I don't know if I can come back to you just to ask you two things. How does a member become a research champion? And also, how would a member access clinical academic mentors?
Yeah, sure. So in short, on the website in the research section, which I've mentioned before, all this information is on there. There is a research network section, and in there you'll find information about what a research champion is, what it entails, and how to sign up. Similarly, there's a careers section on the research area on the website, and this contains information on how we can put you in touch with a clinical academic mentor. If all else fails, you're welcome to get in touch with us. That can be either through the info@rcslt.org email address, or you can send any specific queries about research champions or mentors to me, which I think my email address has been on the slides. And I will gladly speak to you at length about either of those things.
Fantastic, fantastic. And just to let you know, for that Research Champions group and the Clinical Academic Mentors group, we've had really good feedback that this provides lots of kind of networking, discussion, resources, and opportunities to further your EBP approach and your kind of involvement in research. So please do utilize that. I think we've got time for just one last question. So I'm going to come to you, Hazel, if that's okay. What role do service managers have in ensuring evidence and best practice is disseminated to clinicians?
Yes, another good question. It is a key role, key responsibility for managers to ensure this happens. Anna gave lovely examples of setting up the team newsletter, journal clubs. As a manager, that's great because it demonstrates that for all the energy that's going in, it's the most time efficient way for people to share that information between them about updating the evidence base for their service planning and for individual case management. But as a manager, you can't afford to let these initiatives just depend on the interest, the passion of individuals. It needs to be embedded and part of the service so that it's assured for going forward for quality assurance. Back in 2009, I had a paper published where we looked at the context and culture of factors that support evidence-based practice in allied health teams. We found 14 distinctive factors, but the key factor at the centre of everything was leadership. So it's indisputable that the influence of the team lead is very important. So we've got some lovely examples of how people can do this, how they can help to ensure that for their staff. So there'll be further resources, references available after this webinar, which will be helpful to answer that question as well.
Fantastic. Thank you, Hazel. I'd absolutely reiterate that importance on leadership and the importance of the team taking an evidence-based approach. We have run out of time now, unfortunately, so it's just left to me to thank everyone who's helped us out with the webinar today. I just want to sum up by saying that I hope, like me, you find that in a kind of updated version of the model, this is an approach that's truly empowering for clinicians, saying that we really need to utilize our clinical expertise and our patients' preferences, as well as the research evidence, in order to deliver a service that's as effective as it can be to our service users. So thank you very much again to everyone for listening and for presenting today. Before I sign off, I just want to point you in the direction of future webinars, which include topics such as careers and diversity in August and a webinar to mark Stammering Awareness Day in October. So please do visit the webinars page on the website to stay up to date. Thank you very much.